Hi everyone, welcome to Pioneer Bangalore. My name is Afreen Aman and I'm the organizer of this event. Pioneer is a series of deeplearning.ai meetups independently hosted by our global AI community. We organize events which include conversations with AI thought leaders, discussions with industry experts, and workshops with AI professionals. Deeplearning.ai is an edtech firm which works primarily on providing world-class AI education, hands-on training, and building a collaborative community. It was founded in 2017 by Andrew Neck. Here's a welcome address by the man himself.
Hello, deep learners. I'm Andrew Ng, founder of deeplearning.ai, and I'm excited to welcome you to our global deep learning community. I know that many of you are here today because you want to break into AI and build your career. I hope that being part of this community will help you to do so. To give you a proper welcome, I'd like to show you around the deeplearning.ai offices and meet some of the teams so that you can see where it all happens.
Oh, hi, Andrew.
Do you want to tell our friends at pie&ai what you do at deeplearning.ai?
Sure. Hi, everyone. I make articles and other media that help people learn about AI and help them understand the huge impact that AI is having in the world. Today, I'm putting together the next issue of The Batch, our weekly newsletter, and I'm looking for the biggest stories of the week to keep our readers informed.
What's been the most surprising thing you've run into working on The Batch?
How much is going on in this field? There is never a dull moment. You might think from the outside that machine learning engineers really understand everything about AI, but nobody understands everything about AI because this field is just coming to life right before my eyes as I put this thing together every week.
All right, I know you're really busy, so I'll let you get back to it.
Thanks. See you later.
Let's go meet Kian, who helped me create the deep learning specialization. He's working on an exciting new project. Hey Kian, so do you want to tell the people at pie&ai what you're working on?
Yes, sure. I'm leading a project called Workera, focusing on helping people get offers in AI and navigating their career by testing their skills, preparing for interviews and certifying them, as well as matching and referring them to good jobs in AI.
That's really cool. And what's the most exciting part of your day?
You know, the AI field is new, organizations and jobs are still misunderstood. So I'm excited to help people understand what different types of jobs exist in the field, what tasks they will work on, and what skills are needed to achieve those tasks.
That's really important work. Well, it's nice chatting. And now let's go chat to Hotel, who is on their product team.
Hey, Andrew.
Do you want to say hi to our friends at pie&ai and let them know what you're working on?
I would love to. Hi, everyone. I lead the product team in deeplearning.ai, where we create AI education content accessible to people all around the world. People like you.
And what are you most excited about right now?
I am so excited to see our community grow and to see how eager people are to learn more about AI.
Thanks, also.
Thanks, Andrew.
So, as you can see, our team is working hard to support you and help you learn. It's never been easier than before to break into AI. So if you want to build a career, you can leverage online resources available, including open source code, datasets, papers, and online courses like a deep learning specialization on Coursera. As part of this journey, I hope you get your hands dirty too. Don't be afraid of diving in to build your own project, or go ahead and try to replicate a research paper that you're excited about. One thing that I've seen help a lot of people succeed is if you can build a community or find a community of fellow deep learners you can meet with and study with on a regular basis. In fact, I hope that this pie&ai meetup that you're at right now will be a good place for you to meet these people. I hope you enjoyed the event today and that you learn a lot, both from the talks and from each other. And once again, welcome to the deeplearning.ai community.
So that was the welcome address. Today's session is on AI in healthcare, And our guest for today is Nitin Singh. He has over 10 years of corporate experience and 6+ years of experience specialized in AI and healthcare. So I'm going to hand it over to him. He's going to talk about the latest trends in AI and healthcare and also about his journey a little bit. So over to you, Nitin.
Thanks, Afreen. Hi, everyone. So, as you all are aware about, this discussion is around machine learning in healthcare. And thanks for joining in this session. And just a little bit about me, why you should hear me or why I'm here is mainly because I have been in working as a data scientist and primarily in the healthcare sector since more than 6 years now. Um, I started off my career with Amazon, and then kind of gradually moved on to working in specific healthcare companies like Prime Health and Sanofi. So let's get started for the session. So in this session, I'll primarily be talking about um, some of the challenges in healthcare, some use cases around healthcare, and this is more of like a a collaboration of data scientists and working in healthcare, as well as business leaders who are already in healthcare and can actually utilize or understand their existing system to move their organizations adapting into health into AI. So um, so this is just a brief background around what is a machine learning in healthcare. Implementation of EHR. So EHR as in electronic health records. So the digitization of EHR started around 2010. Hospitals and healthcare providers understood the importance of capturing data, and this has slowly migrated into kind of getting FDA approved deep learning applications, software as medical device applications, a lot of AI driven or data driven clinical trials, um, kind of moving from the statistical analysis mode, which we used to see bioinformatics and other um, specific folks doing, as compared to now what is more data driven and heavy machine learning based. So I've just put uh, a brief statement here around what is diagnosis. So what exactly we understand by diagnoses? I mean, so it's more of like say we try to understand this on the basis of certain lab reports or certain symptoms. So if suppose we are having, or say COVID as um, one of the use cases which everyone is familiar with. So how do you understand whether you have COVID? So due to so and so lab tests and due to so and so signs and symptoms. Now is that the reason based on which we understand it is linked to COVID as a disease? So it's not actually right. I mean, the true definition of diagnosis cannot be signs and symptoms only, but it needs more of a machine to compute various relations and metrics together. And this is where AI and machine learning has come into existence, wherein it's not about challenging the knowledge of a physician um, or maybe someone who is working at ground level, but this is kind of taking a data driven approach and trying to understand on that specific problem. So this is what we'll be talking about more in the coming slides. So, what is unique about machine learning in healthcare? Um, it's there are a lot of unique things in especially in healthcare as compared to any other domain. As we see some of the points listed out here, um, it speaks by itself. There is no much explanation needed. However, I'll try to go through each bullet point. So life and death decisions, definitely we understand that if we are talking about, say, mortality prediction, or maybe we are talking about, say, even if it is a disease prediction that leads to certain type of like lab tests or cancer detection. Now in that case, we kind of have to be very sure as to what exactly this we kind of are dealing with, how is the model behaving, and so on and so forth. There is often very limited label data. A small sample size is one of the issues we see. So suppose if we are talking about a rare disease prediction, so we want to build an algorithm around rare disease prediction, but we already do not have much insights or much understanding around a specific disease. We do not have much data, so that leads to a lot of problems. And but then again, there are multiple ways um, in within data science to handle these issues. Adoption of machine learning in healthcare domain is is pretty difficult as compared to other domains like finance or retail. So as we all know, like uh, use cases, if we compare with the finance domain, so it's about fraud or no, or it's about uh, uh, like a person being able to pay insurance or credit card or no. So those are like those are certain problems which is kind of very specific to finance domain, but again, the kind of complexity which comes in healthcare is pretty difficult to tackle at ground level. So from concepts to data, we were talking about how the digitization and things have come up, but however, there is a lot of there is still um, lot has to be done on the digitization side, from hospitals, from patients. There are a lot of now wearable devices and things which is kind of somewhere we see that we are able to generate data around it. All right, so machine learning in application of machine learning in healthcare. Um, so we see that there are it could be, the application could be widespread. As a data scientist, it can fascinate you to work on computer vision. There are enough use cases around it, around NLP and around tabular data. So there is a lot of I would say there is good amount of scope working across all three domains, and we see the use cases listed out here too. Let me kind of go in specific, talk about a specific use case in general. So this is about predicting of length of stay of a patient in hospitals. So if in case we kind of understand that, okay, predicting for specific diseases can be a use case. So this is more around the um, general operations, like the operational standpoint in a hospital system. So predicting length of stay, it's like you try to predict a length of stay of a patient after day 1 or day 2, and based on that we try to kind of discuss that around the benchmark score. So the benchmark comes from the like GMLOS is coming from the US healthcare. So for example, say if I get admitted for a fracture in right hand, that means the length of stay as per the government norm should be just 3 days. So if in case there is the predicted length of stay is higher due to certain other complexities, say apart from the fracture, there are like few other complexities in so that obviously the model would be able to detect and alert the system so that they accordingly plan their operational leads at ground level for a specific patient care. So that's more on a specific use case related to predicting length of stay. Improving accuracy of a diagnosis. So we saw that certain diagnoses, and we saw this definition of diagnosis too, that they kind of follow some sort of rule based or a decision tree based sort of a methodology. That okay, if these are the symptoms, then you take this lab test, and then you go on and take further lab tests, and then we see the overall report, and then come to a conclusion. So these sort of a decision tree of understanding a specific diagnosis at times is challenging in a lot of environments where there are no much lab facilities available, and there is always this issue of cost and a lot of other different components. So in that case, having some sort of a ML based algorithm would definitely help in trying to uh, give clinicians a second opinion and a focused opinion to work on. So I'll switch to the NLP part. On the NLP side, like, we understand that there are a lot of use cases already happening, but I guess in total of not more than 10% of the entire hospital systems have yet started applying NLP, or maybe not more than 20 or so in the entire healthcare systems. One of the most practical use case is around the physician dictated notes and converting that into a structured notes. So we see that there are different um, ways a physician dictates, and that is actually being captured, and that getting um, into we try to take that into a specific tabular format. So that is also one of the use cases which a lot of hospitals have started working, or at least see the importance of it in terms of adapting to a specific NLP systems within their within specific organization. Conversations, so this is one step behind. It's about not just physician notes. So when there is a doctor and physician interaction, that interaction actually getting converted into notes. So we try to summarize, we try to understand the components, try to summarize, and so on and so forth. So this is more there is like a lot of state of art NLP techniques like summarizer, segmenter, and many other things being utilized here, and based on that they come up with this soap note. So this not only gives some sort of um, a solution to physicians to actually check what was the conversation, it also involves um, most of their burnout time, what they have usually end of day, they try to document things. This could actually get automated, and with this they would be able to actually cater more, or maybe understand more at the physician level, at the patient level, try to interact more with the patients. On the revenue side, it's not just healthcare, it's not just around the clinical side and patient care, but there is a lot around the revenue side as well. And so healthcare, it's not just about healthcare data science, it's not just about predicting the diseases and more on that side, but there is also a significant part, a significant number of use cases around the revenue side as well. That is prediction of denials. There are like predict, or maybe trying to work on better billing management, better coding, which leads to, and this coding is not the computer science coding, but medical coding. And so healthcare, it's not just about healthcare data science, it's not just about predicting the diseases and more on that side, but there is also a significant part, a significant number of use cases around the revenue side as well. That is prediction of denials. There are like predict, or maybe trying to work on better billing management, better coding, which leads to, and this coding is not the computer science coding, but medical coding, which leads to um, a better patient billing and so on. So there are like a lot of independent companies already on the revenue cycle management side. And as a from the hospital point of view, there are a lot of use cases which actually requires um, a, machine learning techniques, or even deep learning techniques. and there are still a lot of systems which have not automated or digitized at this level. There is a lot of paperwork back and forth happening between the hospitals, the insurance companies, and so on. So the digitization is the core part, and then comes um, the potential data science use cases which can be applied. So I'll go ahead and talk a little more around this. We talk about the on the denial side. So we one of the use cases around it is we see claims data. There is a claim form, and there are certain fields around it. Now, based on the claim form, we try to understand about. I mean, first there has to be this automation around filling up the complete form and things, and then um, and only then we try to do. So these are like kind of features for a denial prediction, or maybe for um, other use cases around trying to understand mainly on the billing side and on the revenue side. So we talk about hospitali like models into production and hospitalization and so on. So one of the important things is to understand about in healthcare, how do we understand the health information exchange within healthcare. So it's when we talk about models in production, we have to be real time. It's not that we um, try to say predict length of stay of a patient, and we only get the data after the patient's third day visit, or maybe second day visit, or maybe there is a 24-hour lag. In that case, things become, I mean, it's definitely not possible to have a real time production environment data science use cases. So trying to understand how the information exchange, so HL7 and FHIR are kind of the go-to in the go-to leaders in this space, which actually have this system in place of real-time data transfer. And if at all we look for models into production, we kind of have to tap into such systems to be able to get to the level of models, to be able to put across predicted results in real time. So I'll kind of talk a little more on just one slide on the healthcare data literacy side. So the healthcare data literacy is nothing but trying to so when we start working on a healthcare data science problems, the data around it is not just demography or maybe specific other things, which is pretty much interpretable in other use cases like retail or or finance, where we understand about certain um, fields based on like one or two sessions on the domain. But in healthcare, it actually takes years to understand around what exactly each certain fields mean, and so on. So this slide talks about the diagnosis, ICD coding, and the importance of ICD coding overall. So and so on, like the and apart from this, with the other slides are again talking about specific ICD coding, CPT procedures, and SNOMEDs. SNOMEDs are one which is being used in mainly on the NLP side. So this is more related to working on, say, physician notes, where we try to understand the signs and symptoms, and mainly based on that. And if you see on the right hand side, there are a lot of articles already in this. Already people are actually working on um, SNOMED concepts extractions and using advanced deep learning techniques, and through which they are able to kind of come up with say uh, ICD prediction or understanding SNOMEDs, and from SNOMEDs, then try to understand further on the medical coding side and so on. So with this, probably I will stop the presentation here, and I can take questions if there are any.
Does anyone have any questions? You can either ask, come off mute, or you can put it in a chat box.
Hi, can you hear me?
Yep, we can
Yeah.
hear you, Nitin. Yeah, sorry, yeah, we can hear you.
So I was just asking, I understand a lot of it has been discussed in case of healthcare, but there are areas like genomics, proteomics, and transcriptomics, and as well as multiomics. So how is machine learning or deep learning impacting in those words, like for drug discovery in specific?
Right. So if you see, I work with a large pharma company called Sanofi, and there is a lot of research and development happening on the drug discovery side, and trying to understand like how exactly a drug life cycle is, and around the genomic side. However, I kind of I've not worked on a specific use case till now, which is very much on the drug discovery or genomics side of things. My work has more been on the provider side, that is on the hospital driven side. But to answer your question, there are a lot of use cases, and companies like Sanofi or Novartis or even AstraZeneca have invested a lot in coming up in the machine learning and AI side of things.
Right, right. Okay. I had another follow-up question, which was you have mentioned in your previous slides that uh, people in healthcare are not tech savvy, so it's very difficult to put models into production. So and I have attended other talks where I found that digital products in pharma are not, let's say, not made forward, or not much investment have been made into them. So in that sense, what do you suggest? How should one go about it in deploying a model in production in healthcare?
Yeah, I mean, there are like, per my experience, I mean, since I've been working in this in trying to work on a deployable solution back in 2016 and 17, and we kind of faced a lot of challenges, because at times, if you see, like, say, patient length of stay, so this is more, this use case is more around for people who are like at operations level within the hospital, is more for case managers or lead or operating nurses who try to understand based on their EHR screen and see that, okay, if this patient is having higher length of stay, then okay, these are the specific needs, what is required at a ground level. So to make them understand around the importance of how this solution is coming up with, because definitely 100% of the times the solution might not be accurate, and so to build that trust, it's gradually happening. It's gradually happening, but then it would still take time, is what my understanding is.
Okay, okay, yeah. Yeah, so just to give a note to everyone, I also work in not specifically in healthcare, but in the AI/ML side for drug discovery. So I've been also facing the challenge which you mentioned, the idea to gain the trust in AI/ML models. They are not reproducible by default for many of the cases. So they are currently being used for novel discoveries as compared to reproducibility. That's the take I have understood from their side.
Right.
So I think if I had only one last question. In terms of tech stack, what should a data scientist should learn specifically for healthcare?
I mean, on the tech stack side, like, it's kind of all across, it remains the same, wherein the environment what we follow on the on other domains, it's kind of remains the same. But when we talk about say specific healthcare and mostly on the provider side, that is on the hospital side, there would always this component come in about FHIR and HL7, the information exchange side of things. So this component, it's not that a data scientist should understand this concept, because there would be a separate team working on it and you can collaborate with them. But that is one understanding if someone really would want to go deep on the healthcare side, needs to have at least a theoretical understanding. Otherwise the tech stack and things kind of remain the same all across domain. Nothing new on the healthcare side.
Okay, thank you.
All right, I see a few questions on the chat. Maybe if can you unmute and maybe I can answer this
I think I
question.
can just read it out if you want.
Yeah, sure.
Yeah, some folks want to know what is the way to get into an AI in healthcare? Is there a pathway that they can follow?
Yeah, AI in healthcare, a pathway to follow would be try to apply in companies which are working which are taking healthcare AI, like maybe try to apply to companies which are in healthcare and also taking AI seriously. That could be one. Or maybe you can there are a lot of other startups as well which are collaborating with big companies, because not that every healthcare or every hospital system would want to invest right from scratch um, into this building up a team. So they generally would want to collaborate or trust more in other firms who can actually deliver them. So you can try being a part of such firms as well. And apart from that, in terms of trying to get started, like uh, right from scratch by your own selves, there are few Kaggle competition and data sets available. There is a good deeplearning.ai healthcare specialization which can actually be taken up. There is also few other contents around healthcare AI, open content on YouTube and things which can actually be taken up.
All right. Thank you. And there's one more question about, when we talk about models, there is always this question of bias. So how do you ensure there is less bias? And, what about the ethical components around it? How do we ensure before releasing the models into the market? How do we look into the ethical parts of it?
So generally, I mean, when we talk about in models related to healthcare side, generally what we try to do is benchmark it across certain. So suppose if we are talking about disease prediction for say like a sepsis, this is more of an infection. So we try to kind of baseline this with an already existing sepsis decision tree based rule, and how the model performs, and how this um, decision tree like a rule based algorithm performs. And we try to understand between these two, and only if there is like enough evidences that the model is actually outperforming any of these rule based already existing systems, we try to kind of um, always consider research work around it, like as FDA considers certain research papers, and only then they based on certain claims, they try to then assess if certain models would actually, like a rule based and a model based sort of a thing on a good sample size, and then take a decision altogether.
Yes. And there is one more question. If you have some digital twins experience in healthcare, if you would like to share something about it.
Sorry, what is that?
There's a question around if you have any experience with digital twins.
No, I don't have any experience around digital twins.
Okay. Does anyone else have any question? We'll take one last question from the audience.
Hi, Afreen. This is Deepak. I have a question.
Yes,
Yeah, go
Deepak,
ahead.
go ahead.
Thanks, Nitin, for the presentation. So, based on your experience in the clinical NLP side, so which are the popular libraries or frameworks that can be used? And do you believe there are a lot of open source packages available that can be used for the production purpose?
Yeah, I mean, definitely there are a lot of open source packages, and in general, whatever you see on the NLP side, in term like NL, to name a few, NLTK or Spacey, or even if you want to go transformer based approaches like BERT, there is also clinical BERT, which kind of caters specifically to clinical diagnoses and NER, clinical NERs. So that's there is enough open source material available and resources available to actually start applying and helping hospitals or maybe other companies on the clinical NLP side. There are again closed like licensed NLP platforms as well, like Amazon Comprehend and things. Uh, so so you do have good resources on the clinical side. I think deep learning AI has this NLP courseware where you can actually understand about the applications around NLP and or in healthcare in specific, if you would want to go into details.
All right. Thank you so much, Nitin. It was a pleasure having you for the session. It was a fantastic session. Thank you so much.
All right.
And for the audience, we will be back next month with another exciting session. So please join us. Thank you so much for joining. Thanks, everyone. Bye.